Good afternoon, Commissioners. I'm Leslie Irwin, Commissioner's Office staff, and I wanted to make a note about language interpretation. We did indicate that there would be language interpretation. We had a technical difficulty with that. We will be posting an interpreted version of this presentation on the website following this meeting. And Aisa is going to say that in Spanish, so for our Spanish listening audience.
Buenas tardes a todos. Aisa Garita, Community Engagement Specialist. Tuvimos unos problemas con la interpretación. La persona que iba a interpretar la reunión no pudo entrar hacia la reunión, así que estaremos poniendo el link en la página web de ARPA y podrá encontrar ahí la interpretación la siguiente semana.
Thanks, Aisa.
Okay, great. So, as Leslie already said, we're here for an update on American Rescue Plan Act and what we've been doing and where we are with the programming on this. And I can't tell whether there are any members of the public, I guess there are, who are watching. And for those of you who are watching us, this is our third now public briefing, where normally we would have these meetings, we would hear from staff. They are technically open to the public, but it's really impractical for the public to actually get here to the courthouse and listen to the commissioners do our business. So we're really experimenting with trying to do more of these staff briefings in public and allowing the public a little window into how the commissioners operate and the information that we get that the public doesn't always have an easy time getting. So let's go ahead and get into the presentation, and then we're going to hear what 20 minutes, and then we'll have some discussion.
Excellent. Thank you so much. Again, Leslie Irwin. We will be sharing this presentation amongst several staff, one remote, 3 here in the room, and about the American Rescue Plan Act, state and fiscal, state and local, there's a typo there, state and local fiscal recovery fund dollars, and how Boulder County is utilizing those dollars. And next slide, please. And this is a really high level indication or communication about our total amount of funding. So $63,359,749 were awarded to Boulder County. We have to fully obligate those funds by December 31st, 2024, and they have to be fully expended by December 2026. And we want to highlight right at the front end that racial equity and community engagement are a strong focus of these funds, both how they were communicated to us from the federal government and then how we are implementing things on the ground here at Boulder County. And I'm going to pass it to Kathy Sandoval to speak a little bit about about racial equity with ARPA.
Good afternoon, Kathy Sandoval. Chicana, she here is Aya, and I'm a racial equity practitioner and project specialist for Boulder County, and working on the ARPA program with racial equity. And we've seen certainly throughout the whole pandemic that there was a disproportionate impact to Black, Indigenous, people of color communities, LGBTQ communities, youth, disabilities, homeless. And there's no difference here in Boulder County. We saw the same impact that we saw nationally. So to address those disparities, the ARPA fund specifically outlines requirements for equitable recovery. And it's to that end that Boulder County focuses on racial, economic, health equity. And as stated in that plan, we try to deepen and address that racial equity focus by using a tool that we have with our partners at the Government Alliance on Race and Equity called the Racial Equity Impact Assessment Tool. And that allows staff to collaborate with project managers and community partners to incorporate equitable outcomes, utilizing disaggregated racial data when available to mitigate unintended consequences. And the challenge has been certainly to move the intent of the program, some of which have been ongoing before the pandemic, to a new way of being by normalizing racial equity work as part of the ARPA program. Next slide.
And these are the allowable uses of the ARPA funds. I've highlighted 2 of them here, which those are the areas that we are awarding projects. We are not awarding projects in the other areas. So public health impacts, negative economic impacts, and replace lost revenue. And we'll be going into that in more detail later on in the presentation. This is a summary of the different funding rounds of ARPA dollars. We had an immediate needs process in 2021 addressing those true immediate needs. And we will provide some examples of those projects here in a minute. That was 5.2 million. And then we had phase 2 projects, which really followed a robust community engagement process. And Aisa will talk more about that in a bit. And that's $46.48 million. And that occurred in 2022. And then the commissioners awarded a $5 million reserve in 2021, and some projects have been awarded from that reserve, and we'll be showing the unallocated amounts later. So the math is a little clearer to the public as well, but this is just a summary of the funding rounds. And here are some big highlights. And so we aren't able to include all of the projects in this because some of them are really just still in planning and don't have clear estimates, but we're anticipating that more than 15,000 residents in Boulder County or households will benefit from ARPA dollars. 424 businesses and nonprofits at least will benefit. We're collaborating with at least 33 local groups and organizations in the community. ARPA dollars will have a hand in creating or preserving 441 affordable housing units. And the number of projects we are tracking in the Treasury portal are 49. So we have to report on 49 projects for ARPA, and that's a lot. And I just want to say we won't be able to talk about every project here today. So we'll be highlighting some projects for you. And next slide. And I'm going to turn it over to Sophia, who's going to tell us where to find information. Since we can't talk about all the projects today, we want to be sure that everybody knows where to find out more. Sophia?
Thank you, Leslie. Good afternoon, commissioners, everyone. I'm Sophia Lenny. I work as a communication contractor for the Commissioner's Office, and I work with the American Rescue Plan Act. So we have different platforms to communicate to the public what is the status of the public funds. And this content is located in bolco.org/ARPA. You can find, as you can see on the top of the website, there is in Espanol, in Spanish, and we have the content in English. You will find information on community engagement and planning that later on in the presentation, Aisa Garita will be talking about. We have information on the immediate needs project, how funding was allocated, and phase 2 pandemic recovery and relief projects, and stories on how funding is impacting our communities in Boulder County. We also have the reports that are very important for public transparency, and we have the recovery plans performance reports for 2021 and 2022. And we have the ARPA newsroom. Here you can find information, the latest news releases, top stories, meeting recordings, and for example, the working group presentations were part of the community engagement process. Next slide, please. On this section, which is the ARPA fund distribution, you will have actual expenditure categories. And if you click on each one of these pie charts, you will have the expenditure categories by project and the cost of each project, and it's a breakdown. So you will find really a lot of information there that you can find is current. And next slide. Another platform that we have to communicate for the public is the ARPA newsletter. This is a newsletter that is published. One newsletter is sent every 2 months, and you will have communications that provide articles, interviews, stories. There are all the information and current content about ARPA funds and the use in the 3 main areas of investment in economic challenges, housing affordability, and mental health and social resilience. And as you can see, you can go there and subscribe for the newsletter, and we have the same in Spanish and English. And for that, we'll pass it to Leslie.
Thanks, Sophia. So here's a little bit more information on the immediate needs projects. There's that 5.2 million again. These projects funded those critical needs, at the beginning of the pandemic that arose, like food insecurity, employment, digital connectivity, childcare, COVID-19 testing, quarantine, and communications. There are 21 immediate needs projects. 4 of those have been completed. The remaining are underway. And again, people can find out more about those on our ARPA website. I did want to highlight one of those projects, which is the next slide, I do believe, and that's the Digital Divide Project. This was a really exciting project. One thing we found out early on in the pandemic was connectivity was a real barrier and really caused those disparate impacts in the pandemic when people couldn't connect to school or work or other resources that they needed. And so we provided devices through community-based organizations and to provide devices and training and minutes or whatever were needed to provide that connectivity. And I think more than 400 devices were provided out. And what we have heard back was this was really critical for young people and adults in our community for being able to connect to school, work, services that they needed. So a really exciting program that met a lot of need in the community. And then phase 2 projects, again, there's that 46.48 million. ICE is going to tell you a little bit more in a minute about the buckets, but the buckets for these projects are economic challenges, housing affordability, and mental health and social resilience. I don't have time to talk about all those projects, but they are on our website and we will highlight some of them. But there are 28 phase 2 projects, 15 of those are underway, 2 are complete, and the remainder are in planning or program design. But you will see that there are, in the economic challenges, there are things that help nonprofits and businesses and individuals. In housing affordability, you'll see that there is work to develop affordable housing and preserve affordable housing and do new things with manufactured housing parks. And in the mental health and social resilience category, it's really all about access and providing access in multiple ways that we can. And that is a quick highlight of phase 2 projects. And I'm going to hand it again to Kathy Sandoval to talk about what racial equity looks like in projects.
Thanks, Leslie. So as I mentioned earlier, Boulder County is centering racial equity as part of our ARPA programs. So how do we see this develop? So I've got a few projects listed on this slide. I'm just going to briefly go through how racial equity is involved with the ARPA program. The first one is the Regional Housing Partnership. This is a countywide project to create affordable and home ownership program. As a collaborative effort with municipalities throughout Boulder County, they have centered racial equity as part of their intergovernmental agreement, and they're also going to be using disaggregated racial data in their collection. Another project that really is focusing on racial equity is Family Connects. They'll provide postpartum support for families in Boulder County. And the program is centering race by its messaging and to show how their approach reduces those racial disparities with that information, connection, and services to underserved communities. So as part of their team, they visit families and their staff, who have several bilingual staff to help with that, are providing referrals to community partners. They're also centering racial equity in their solutions by including family voice ambassadors, as well as community advisory boards that are from the BIPOC community to co-create the program, the trainings, and the implementation. And finally, the Longmont Child Care Village, they're in the process of purchasing a building or land, and that will be a hub to create 20 classrooms serving children from age birth to 5 years with a mix of Head Start, Child Care Assistance Program, Universal Pre-K with a sliding scale of fees. And these services will also include care for special needs children, home visitation, group learning sessions, health and nutritional services, and professional development to support early childhood education professionals. Next slide.
Thank you, Kathy. I'm Zagarita, Community Engagement Specialist, and I'm gonna talk a little bit about the community engagement piece and what has been our focus since the beginning and continue to be our focus is creating opportunities to engage with the community, giving them the resources, creating those resources, and how to engage in this funding allocation. And to ensure that we have been collaborating with community-based organizations to ensure that the information and these funds are available to the public in different ways. As well with the racial equity part and the communications with Sophia. And to ensure this, we have been creating presence in public events, as well as in the past and in the future. This year, for example, we will be attending the Cinco de Mayo, and we're working on different events where we will be sharing about the ARPA funding specifically, and if people have questions, how to approach that in person. As well, last year we attended the resource fair, that was from the county with a partnership with the city of Boulder, where we created awareness to the public about this funding allocation. As well as Sophia shared before, we have the newsletter where we will be highlighting later. We have been, but we will continue to be highlighting the ARPA programs, specifically with the interviews, as well as how the funding allocation for a specific program is, partnerships, new approaches. So if you want to be in the know, you can sign up for the newsletter, and this will be bi-monthly newsletters going out. As well, to ensure that language access, we translated the whole ARPA website to Spanish. So you can go to the website, you can see and read everything now in Spanish, and we're very happy for that. So you can go to the website and find more details in there. Next slide, please. And if we go back to 2021 and 2022 of our community engagement process, we created a working group. We worked with the ARPA steering committee that helped us supported our survey that was conducted in 2021. From that, we got 1,543 surveys completed. Thankfully to the community and all of our partners helping us, we were able to get to the priorities of how to get to the funding allocation for this fund from ARPA. And as Leslie shared before, the economic challenges, housing affordability, and mental health and social resilience came out of that community engagement first phase. As we moved to the second phase, that was in February to May of 2022, that's where we created and did a call for working groups, and specifically the economic, housing, and mental health and social resilience. From that, we selected 39 participants that supported us from different organizations in different buckets in there. And from that, the recommendations from the working groups went to the board. And thankfully now some of these fundings are going out to the community. And I just want to thank all of the participants, if they're listening right now, that thank you to you for supporting in this effort and giving us your time and your expertise. I put a little picture in there. I hope, just thank you. And as we move from our second phase, we can move to the next slide, please. Phase 2 is specifically as we move from 2022 to 2026. We, as a community engagement team with Kathy and Sophia and communications and racial equity, we are supporting all of the ARPA projects. This looks different for each project, as some of them need more engagement, more of the racial equity and communications than other ones. But we are ensuring that we continue to be in partnership with local organizations and local governments to ensure that the community has this information handy, that they know where to go, how to access some of the programs that will become available through the funding. And I'm just going to speak a little bit about what's going on right now, but the Survive and Thrive, for example, I know the public have been very curious about the funding for Survive and Thrive. So we're currently in a working group, working with a working group on this. We are hoping by late summer to have in detail how you can access and get to the funding, and just know that we're in the process, we're working on it. We will find all those details as it becomes available. I will be sharing them with you, so you will have that information of how to access the funding when it goes out. As well, we're working on a mobile home park surveying initiative at the moment with the University of Colorado. This specifically falls under the mobile home park program. And this survey will help us learn about the community mobile home parks when we talk about home ownership and repairs. This survey will be happening in June to July in the locations of Longmont and Lafayette. So if you live in those locations and you know people, just know that we will be going door to door in the month of June. So I will pass it, I think, to Kathy.
Thanks, Aisa. Aisa went through a little bit of the mobile home manufactured housing program that we're doing countywide. And we just wanted to highlight it again. So this is a meeting, community meeting at one of the manufactured home parks, where they became a bit more aware of what the potential is to become a resident-owned community. So it is quite a process to move from a landlord type of mobile home park to a resident-owned community. And so these folks are working on it to form their resident-owned and buy their park. And the program is really going to help to provide some of that assistance to acquire that park. Not all of it, but within partnership with other communities and cities, like the city of Lafayette or the city of Longmont, as well as Department of Local Affairs. This can be a real thing that happens in our Boulder County community. As well, the program also, as Aisa was mentioning, is a home repair assistance program for low-income residents, and potentially a major infrastructure improvement project for those resident-owned communities, or even for landlords that are committed to long-term affordability as part of their project. As we were saying earlier, the CU Geography Department at Boulder, under their Affordable Housing Initiative, will conduct surveys of the manufactured home parks in both the cities of Lafayette and Longmont to really get a better sense of what is going on in the manufactured home parks, their assets, their challenges, and opportunities. And the cool thing about this is that we have community navigators, not just CU students helping to go out there, promotores that are part of the community with the same culture and language as the people whom they work along with, and the community residents that they have familiarity with as well. So it's a real opportunity to have more information for us to know in Boulder County about the manufactured home parks in Boulder County, and to really have a goal of preserving these important affordable housing in Boulder County. Next slide. I think turn over to Sophia.
Yeah, thank you, Kathy. So Family Connects, Kathy talked a little bit about this program before, but I will explain a little bit further. This is a new resource for parents with newborns in Boulder County to offer highly skilled nurses in home care, and they are bilingual in English and Spanish. This is a voluntary program that has no cost and will help families to connect with resources with their specific needs. So the family will receive a visit around 3 weeks after birth to ensure new parents continue the support they need. For example, vaccination visits, exploring childcare options, and promote child development among many other benefits. Family Connects is designed to provide care regardless income, status, race, ethnicity, or sexual orientation. Right now they are working in a 2023 pilot program with some families, but we hope to expand further. And if you want to learn more about this program, you can go to boco.org/familyconnects. And I'll pass it to Aisa.
Thank you, Sophia. I will be speaking a little bit about the Equitable Access Program that falls under the Mental Health and Social Resilience bucket. The Equitable Access is a community-based program for mental health services and school-based services. 7 local community nonprofits were awarded, and 2 school districts were awarded to expand or create new programs to support equitable access to mental health and behavioral health in Boulder County. And you can see the list of nonprofits as well as the school districts that were awarded the funding. So this funding has been out, and if you want to learn more and understand more, we are highlighting each individual nonprofit and school district in our ARPA newsletter. We already have been highlighting, so you can go to the boco.org/ARPA to read about each specific nonprofit or school district in the website. I don't have enough time to talk about each specific one, but they have been doing wonderful work in our community, and we continue to partner with them. So thank you all, and I will just pass it to Leslie.
And commissioners, this slide is kind of dense, I will say that, and I think we're at time. So I'd ask your guidance now. The next slide after this is one teeing up questions. Should I handle this slide now, or should I come back to it if there's time?
Let's do this one.
Yeah, I think we should.
Okay, so at the very beginning of the presentation, I mentioned revenue replacement as a category that we are awarding projects in. And so U.S. Department of Treasury allowed a one-time standard allowance for revenue reduction in January of 2022 of $10 million. And Boulder County did take that standard allowance in January of 2022. And then I want to explain what that means. So if you look at the spreadsheet or the little table there, the first column is ARPA dollars and how we've spent ARPA dollars. And so ARPA dollars have been awarded in immediate needs, phase 2, and then there's revenue replacement. That category right there adds up to $10 million. We've allocated $9.3 million in revenue replacement projects, and we have an unallocated balance of $642,000 in revenue replacement projects. 4 of those revenue replacement projects are actual projects that we're tracking. Another is the funding for Boulder County Public Health that you typically give to Boulder County Public Health every year. We gave them those funds from ARPA, which freed up that money in the general fund, and that money is being used for ARPA projects with those additional flexibilities offered by Treasury for doing so. So continuing on in the ARPA column, there's the administrative category, which is 10% of the total budget, a reserve amount that has been allocated so far. You all awarded a $5 million reserve, and that's how much has been awarded out of that. And then that remaining ARPA balance is what has been unallocated out of ARPA, and that adds up to our total award. The next column there shows the revenue replacement and how that has been spent. The $1.3 million represents those 4 projects I mentioned that are actual projects in the revenue replacement category. Those were immediate needs projects that we moved over into the revenue replacement category. And then $8 million so far of phase 2 projects in that category with that unallocated balance of $642,000. So you'll see that adds up to the $10 million. The green part there just shows how much total for each round of funding, the immediate needs in phase 2. So that's matching up with that slide at the beginning of the presentation. And then you'll see the unallocated balance there at a total of $779,943. And I know that's extremely dense. Find out a little bit more on our website soon. We'll be posting messaging around this or explanation around this soon on our website. And we're always happy to answer questions as well. And I think the next slide just tees up some questions you all might want to talk about. And we're open to any questions you have or comments you have as well.
Well, thanks, Leslie, Aisa, Kathy, Sophia, for organizing this, for one thing, a lot of material to put together. I saw Commissioner Loachman taking a lot of notes. I have some questions. I'm sure Commissioner Stolzman does too. I appreciate the thought you put into trying to tee up some discussion questions, but let's, why don't we sort of do this a little less formally? We may cover those, but I think this is really for us to just get this update and see where we are. So
that's great.
I will hold my questions till the end and invite either of my fellow commissioners to jump in. And, and if you want to explore these questions on here, that's fine too.
I agree. I think you covered most of the potential questions already in your presentation. So thanks, and thanks everybody for the update, the work, and also for putting together this opportunity for public to hear about that. And of course, the interpretation will figure that out and come back. But I appreciate the attempt to do that. I had a couple of questions, and I don't know if you want to go back to slides or you want me to just kind of bring up the questions. They're all notated in my notes in the slides as you've been talking, so I can give you that slide for reference if that's helpful to anybody. I'm wondering about, and maybe the funding piece is to start, so I'm on slide 4, around if there is any opportunity in this whole process if we considered it as a team about if there's anything that we initially worked on and listening to the immediate needs, I'll have a question about that too, to where that second tranche of money was and where we are now, because keeping in mind, we are 3 years after we were all in stay-at-home order. So taking all those pieces into account, I'm just wondering if there's anything, or maybe a time that we're gonna look at, is this still feasible? Because what I heard is some of these immediate needs projects have still not been completed. Is there a space for that? Is that something you are considering?
Yes.
When would we do that and how would we make any of those decisions?
Yeah, so all along the way, our team has been tracking when projects do wrap up or whatever, the unallocated amounts from projects, and that goes back into the bucket. And as far as all of the immediate needs projects, many of those receive state funding that had to be spent before our funding. So we have extended most of those projects through 2023. We have an annual report that we'll be doing in July. And we were going to take that opportunity in June and July to really analyze all of those projects and where is the status and what should continue and what should not. So yes, there's an opportunity and already a plan to really look at all of that with our annual report when we do the really robust analysis of everything.
Okay, thank you. And commissioners, if there's something that you want to jump in at the same time, please do.
No, that was a question I had too.
Okay, well, and similar to that was just around the immediate needs question and trying to go back to the beginning of 2021, a year into the global pandemic, and thinking about one of the projects that you talked about under immediate needs. I guess my it is back to that same question about would we look at that as so feasible? But there was, to me, and maybe there's an opportunity in the website to define what is new projects, what was immediate funds in my mind. If I go back to those conversations, was some of it was work that was already being done that was funded by the previous CARES Act funding. Some of it was money, if we think about vaccines and that process, then that was already being done by public health. It was like $1 million. We're already out there doing all this work. And so just some, I think from transparency standpoint would be really helpful, because it can be confusing about what's new work and this call to it. I didn't hear today, but I know it's been the conversation about transformational change in Boulder County. And some of this is like shovel ready, not transformational necessarily, because it's been worked on for years and years before. So somehow just delineating that in the website to me would be really helpful.
That's helpful. That's helpful feedback. Thank you.
Could I just jump on that?
Mhm.
Also, I think I heard this in part of what you were asking, and when we were making those decisions about immediate needs, and we had said that $5 million right now because we have a pandemic, we were still very much in the health phase of things and trying to stand up vaccine clinics and and respond to the need for enhanced, like, folks stopping unemployment lines, all that stuff. And we were very, we said no to some things because it really didn't fit that immediate needs. I'd love to see that list again, because later on, when we talk about the spirit of ARPA money that we haven't allocated, and some of the things that maybe we'll find out a little bit what down the road we're not going to be able to spend. I'd love to see that list again and see whether we want to circle back and consider any of them.
Absolutely.
Yeah,
We'll bring that to
and
our
I know
future
that
meeting.
was really developed for immediate needs, but I think one of the reasons we said no is because they didn't strike us as immediate, given where we were.
Right. That might be considered now.
Yeah, exactly.
But we will plan to bring that back to you.
Great.
Thank you. Yeah, that's great. I'll try and hurry to my
Yeah.
question. Press, slide 9, the ARPA news. Just curious about where, for the public, in the conversations that we've been having with the different working groups and the steering committee and the public meetings, if we've asked the question on what our the newer but also established community partners might be saying in regards to how to get this information out. And all the work on the newsletter, some fantastic stories that have been captured. But so that's one. Have we asked our community partners how they would like us to disseminate the information? And then the other question is if you could just share what new press and methods or techniques of distributing information through the community engagement process have been developed through this ARPA engagement process, or where that might be in the scope of things.
Isa, do you want to take that question?
Yeah. So something that we were thinking of as well is how do we bring this to more community members, and specifically that is a challenge as well when we think in different programs. How do we do that? Because all go to different communities. We're talking about affordability, like housing affordability, mental health, that is specifically a different one. And then the Survive and Thrive specifically works with nonprofits and the childcare. Something that we have been thinking is, how do we bring this newsletter that right now is on the website to in person? How do we bring all of this content out that is not just online, because not everybody has access to internet or computer, or they don't know how to access the information. That's something that we're thinking of. How do we do that? And as you're saying, asking the community, the partnerships, how can we create an engagement specifically for each project? So we have been navigating as well individually for each project instead of a big approach, because it doesn't work specifically for each one. But that's something that we have in mind. We're thinking of it. So we might be asking as well as partners, how do we approach that? So it is equitable to the community, and we're approaching that as culturally as well, because it's not the same. So we know the website is great and the stories are really great, but it's not accessible to all. So thank you for bringing that up, and that's something that we have in mind.
Thank you. Racial equity in projects, back to slide 13, it looks like. So just again, delineating in our conversations or messaging and the website and all those different places. Some of these projects aren't new to ARPA, i.e. the regional housing partnership, but just so that we're clear with community, so folks understand what we're finding that was already in the works, maybe what's getting some form of racial equity assessment tool, like that's not new to the county either, based on ARPA. It's work that we're doing. So just again, in transparency, so that we're not potentially giving the message that this is transformational work. Some of it's just work that we've done at the county beforehand. I think the other question that I'll have, and this might just be for conversation too, if we have time, is about similar what feedback you've gotten from community partners about how to continue in collaboration with the county long-term, based on all this effort that you all have been involved in, all the different partnerships that have been developed. So that's.
Were you finished?
Sorry, the very last question I have is about how folks will find the application process and what kind of methods for the, like Survive and Thrive is one. Are we working with everybody? And I say that because there was like 130 people who applied to be on these different committees. So just to make sure that they can share the information, even if it's not under the one bucket that they're focusing on, which I'm sure is a part of the conversation. That's all.
Because, yeah, thanks for all those questions. And I was just thinking we really ought to move on, just so.
Yeah, I'll email the rest of my questions, because I have questions for every side.
Okay. I have a question I'd just like to ask, and we were going to meet in another room, so I'm facing this way so everyone who watches the video will be able to hear. So I apologize for any awkwardness of that. But my question is really around clawback, and I continue to get emails from our partners, like at National Association of Counties and others, about different legislation at the federal level introduced with clawback provisions in it. So right now in the Senate, it seems that like everything pertaining to money, it has a clawback provision in it. I know just last week, the senator from Florida introduced some amendments to that extent. And so are we doing anything to ensure that we can obligate? I know we have a really great plan to have it obligated as for by the end of June or by the end of the year, but my question is, are we doing anything to ensure that these funds that can really help and support Boulder County in hopefully a transformational way don't get clawed back to the federal government just because we're using a deliberative, thoughtful process? It takes a little longer. So that's my question.
And that's exactly right. We are being more deliberative and doing the community engagement work and the racial equity work, and that takes time to do. And we are working, as quickly as we can to obligate those dollars. One challenge in local government is that legally, for state law, you can't obligate a budget for multiple years. So local governments have been challenged on how do we obligate future years of payroll or future years for these projects. But Treasury does in their guidance allow us to write a local procedure or local policy to explain how we're obligating dollars outside of the typical means. A typical means would say you have a contract or a purchase order, and that's it. So this is a more expansive permission that Treasury gives us to say how we obligate payroll. And we are looking at fully obligating the projects, and in the June 30th report deadline, we're obligating whatever we can for the April 30th deadline. I would hope that the US Congress would give us the time to obligate the funds fully this year. The Treasury deadline was fully obligated by the end of 2024. So it would seem very unfair to ask communities to obligate earlier than that stated deadline. And I feel confident that we'll be fully obligated by the end of this year, and hopefully by mid-year.
Thanks for working on that.
So I have a couple of questions well, maybe I'll ask the question on the spirit of ARPA, that graph, and don't bring it back up. I think it's not about the specific numbers, but I did want to make sure that it was clear what we're talking about with spirit of ARPA, first of all, and that some communities were able to really document a loss of revenue, and they needed that money to backfill their budgets right away so they could keep services open, especially when those that were serving community. And for us, we saw this as an opportunity to fund the reason we call it spirit of ARPA is that we wanted to do things that were consistent with the ARPA directive, but that may have challenges in terms of all of the reporting requirements. And so, I think we've really tried to stay true to that and fund these things consistent that helps, especially some of the smaller nonprofits avoid the paperwork and reporting requirements. But I'm wondering, with the amount that is unallocated at this point, what you're envisioning for a process to allocate that. And really same question for any of the areas where we're finding, when we made these decisions, which we all thought were fantastic decisions at the time, and then some of them we ran into implementation issues, where we may have some money that we haven't been able to obligate. But what do you anticipate for making those decisions?
Yeah, so that's a great question. So right now there's that $779,000-ish of unobligated funds. And our plan is to bring those to you in the near future for decision making. So for the immediate needs, we put sort of an all call to county staff to identify needs in the community. For the phase 2, there was a process to open it up. And so this one, we don't really have funds to open the floodgates to any requests. I will say that 2 requests that I know are floating out there are a request around behavioral health and needs in the behavioral health system, and a need for emergency rental assistance. And so those are 2 concrete needs I know are floating out there in the community. And we likely would bring those to you and ask for if you want to proceed with those, and if you have any guidance around opening up to other potential projects. But those are the only 2 I've heard floating out there right now.
I think there was also potentially one from public health.
That's the behavioral health
Oh, that's
request.
the behavioral health. Oh, okay. Okay, good.
Can I ask a question on that? The graph, just because we're talking about the funding, do we have a number handy around, and the initial ask for the 10% kind of hold for administration? Do you have an idea of how much of that money's been spent so far?
Next question.
It was a
Yeah.
question, and so.
Yeah, so I will say that bucket is obligated, is fully obligated. We gave administrative dollars to community services, housing and human services, and public health in that bucket. Also in that bucket is the program evaluation and data project, which Treasury actually took out of that bucket, but I'm leaving it in our bucket for that purpose. Treasury took that out of the admin bucket. But we are leaving it in, and planning and community engagement are also in that bucket. So there's a lot in that bucket. And I just will say, I know that you all would rather we not spend 10%. I do know that. And I will say for federal grants with this complexity, 10% is actually pretty low. With CDBG-DR, our project delivery is what they called the admin bucket there. It ranged from 13.75 to 20%. And so the federal grants are really onerous to administer. And right now that bucket is obligated. We look for savings at every opportunity in that bucket. We do. But right now we want to plan safe all the way through to 2026.
Yeah, well, so I guess the other question I have, and then I wanted to come back to just a little piece of that question that I was sure I understood, but you know, with most of these things, they're not one time. Some of the housing is one time, but I'm thinking about the Family Connects program. I'm thinking about all the behavioral, mental and behavioral health funding. What are we starting to look right now at money to continue those programs? And I think some of them we were looking at them maybe, you know, to pilot and then think about continuing, but just given how long it takes to get money into the pipeline.
I think that
yeah.
I think it varies by projects. I think that whole behavioral health box, they are looking at other funding and sustainability multi-years out. The Family Connects and the direct cash assistance are really wanting to be proof of concept to find that permanent funding. I don't know that they've identified those sources at this point, but I know those programs for sure are thinking about that.
Because I know there were some where we said, okay, yes, it's one time, and we're really trying to focus on one time, and then others, and I can't just from these slides identify which ones. It was, yes, we want to continue it, and we think we know where we'll get it, but we need to be on that. Just back to what you were just saying about the 10% and Treasury and what they allow, they don't allow. I want to make sure I understood what you said when you said Treasury took was it the data analysis?
Program evaluation and data was in the administrative bucket, and they took it out because they.
What does that mean to take it out?
Treasury won't count that as our 10% in our 10% admin bucket. I still have it in our 10% admin bucket, but Treasury doesn't have that. What that means is that we could actually charge more admin dollars than we are right now.
Oh, I see.
But I'm counting it in our admin budget. I left it there. And the reason is Treasury thinks that the data piece is so important. They didn't want it constrained in that admin bucket. So they took it out so that we could dedicate resources to that data
More
piece.
conservative.
Yeah.
Yes, I'm being more
taking a
conservative
approach.
and leaving a program in the administrative bucket that is not, so that I am not spending 10% on admin. But I'm
Yeah, I
counting
want
it.
to make sure I understood that correctly, that it's not that Treasury said we can't spend the 10% on it, it said we don't have to.
Yeah,
We
they
can
took
take
that
it
out of that
We
bucket.
can take it out of program, okay. I just have one more, I think we've got like 2 minutes.
One, less than one.
So, if, I'll ask my question.
Yeah, go ahead.
Okay, I want to make sure everybody else that needed to jump in could. Just back to early on, the more than 15,000 people served. I mean, some people would look at that number and think it's kind of small. And I was wondering, does that include, like, we don't know how many people will use the mental health
It
services?
doesn't include those.
Okay,
So
that's
there are
what I'm
some big
wondering.
programs. I should have put an asterisk there.
Yeah.
There's some big programs that aren't in there. The
Okay.
behavioral health, we have no idea on that. And some of those
I mean, the
programs.
same for Survive and Thrive, we haven't awarded those grants. Some of
Right.
those could be served lots and lots of people. Okay, that's what I just.
And
wanted
also in that
clarification.
15,000 number are some families. Some people reported individuals and some people reported families, and I had no way to disaggregate that. And so families might be 3 members. And so it's a lot higher than the 15,000. That was just the best I could, with a straight face say, we know it's at least 15,000.
Okay,
It'd be a lot more than that though.
okay, yeah, good. Well, that's everything I had. There was a lot to cover in 55 minutes.
Thank you so much, commissioners. This was a great conversation.
Yeah, thank you for that. Thanks to everybody on the screen, Maggie, Sophia, and everyone in the room. Right?
Appreciate
Good update.
Thanks, everyone.
Thank you.